Alright, picking up where we left off with dementia, you as a nurse, you should assess the patient for the onset of when the symptoms occurred, for the duration of the symptoms, the progression, and the specific symptoms. If the patient can't answer for you, it's always a good idea to have the family involved in care. There are 3 categories of Alzheimer's disease. They can be found on page 873 in chart 4213. One of the first symptoms of Alzheimer's disease is short-term memory impairment. A mini mental status examination or mini mental exam is when the individual is asked questions based on 4 categories. Those categories are listed on page 874 in figure 42-2. Changes in behavior and personality. With Alzheimer's disease, behavioral changes can occur in the advanced stages. Aggressiveness, rapid mood swings, increased confusion at night, or when light is not adequate is known as sundowning. The patient may experience paranoia, delusions, hallucinations, and depression. In early stages, patients may recognize their changes and hide their symptoms. Traumatic relocation syndrome is something to be aware of. This can occur, and it happens when a patient with Alzheimer's disease is admitted to the hospital. The individuals can become aggressive or abusive. Chronic confusion and risk for injury are common nursing diagnoses for patients with Alzheimer's disease. It's important to look at factors that can worsen Alzheimer's disease. There's a list of those factors on page 875, table 42-5. Genetic testing may be helpful as an ancillary test, but there is no way to predict Alzheimer's disease, and there's no definitive way to diagnose Alzheimer's disease until an autopsy can be performed. It is important that Alzheimer's disease patients have a structured environment. Environmental distractions and noise should be minimum. Sentences should be clear and short, and attention should always be directed to the patient. Clocks and single-day calendars are important, especially for those in early stages. Reality orientation is appropriate. For those with moderate or severe Alzheimer's disease, validation therapy is an appropriate technique, and that is when the nurse recognizes the patient's feelings and acknowledges their concerns. We should be toileting patients on a regular schedule. Individuals with dementia oftentimes have speech and language problems. Aphasia is when the patient has difficulty speaking and understanding language. Aphasia has 2 subcategories, which are expressive aphasia and receptive aphasia. Expressive aphasia is when there's an inability to communicate or convey words. Receptive aphasia is when there's an inability to comprehend information. Anomia is difficulty finding the words associated or the name of an object. Apraxia is difficulty recognizing words. Drug therapy is common for treatment with Alzheimer's disease. Aricept and Exelon are cholinesterase inhibitors, which delay destruction of acetylcholine in the brain. Namenda is an NMDA receptor antagonist and blocks excessive amounts of glutamate that can damage nerve cells. Antidepressants can also be prescribed for these patients. Preventing injury and managing caregiver role strain are very important with Alzheimer's disease. The next disease process is Huntington's disease. Huntington's is hereditary. It's transmitted as autosomal dominant traits at the time of conception. It causes neurologic and behavioral symptoms that occur between the ages of 30 and 50 that worsen in the next 1 to 2 decades. The disease process is very gradual. Men and women are equally affected. There are two symptoms of the disease, and those two symptoms are progressive mental status changes and coriform movements. Coriform movements are rapid jerking movements. Dementia is related to the destruction of neurons within the cerebral cortex. It can also be related to excess amount of dopamine. There is a decrease in the amount of GABA, which causes increased activity of parts of the brain, which cause those brisk, jerking movements of the limbs that the patient cannot stop. There are 3 stages, with each lasting about 5 years. Stage 1 is the onset of neurologic and psychological symptoms. Stage 2 is when there is an increased dependence upon others. And stage 3 is when there is a loss of independent function. Diagnosis relies upon 3 factors: neuromuscular symptoms, dementia, and dominant inheritance of the gene. There's no cure and no treatment. Those affected, to prevent the transmission of the gene, they should avoid having biological children. Medication can be taken to decrease chorea. Physical therapy and occupational therapy is needed for exercises and for practice with assistive devices or adaptive assistive devices. Individuals with Huntington's disease typically die from pneumonia, heart failure, and other complications associated with immobility. Make sure that you are learning terms as you go throughout each of the chapters. It's just important to learn terms as it is to learn about each disease process and what you should do as a nurse. When you're testing, if you do not know what a word means, you could get the answer to the question wrong because you're not fully understanding the terms. So just be sure you go through and read the terms, and remember you want to focus on how you differentiate each disease and what you as a nurse would do for each disease for nursing interventions.